So mRNA technology has been around for decades. The story begins with 𝘞𝘩𝘾𝗋𝘂𝗹, a biochemist who faced the majority of the 1990s being rejected. Her research has been dedicated to harnessing the power of mRNA to fight disease. But she was told her ideas were too far-fetched for government grants, corporate funding, and even support from her own colleagues. Her refusal to give up laid the foundation for the Pfizer and Moderna vaccines that we now have today. Her genius was further realized when other doctors and scientists began using her groundbreaking ideology for HIV and cancer research. Advance to the next slide, please. One of the reasons the vaccines were developed so quickly was because of the foundation laid by Ms. Quireco and the contributions from doctors and scientists of color, including, as shown on the screen, 𝘊𝘖𝘆𝑚𝑒𝘐𝑒𝑗 from the National Institutes of Health, Dr. 𝘊𝘖𝘐𝑒𝑚𝑎 and Dr. 𝘊𝘅𝑒𝘠𝑚 and Dr. 𝘊𝘘𝑒𝑚. Both the Moderna and Pfizer vaccines use messenger RNA. This is a substance our bodies naturally produce. The mRNA technology teaches our bodies to protect us by making antibodies and other infection-fighting cells. The mRNA from a COVID-19 vaccine never enters the nucleus of the cell where our DNA is kept. And this means that mRNA cannot affect our DNA in any way. Once the mRNA has finished teaching our cells, enzymes break down the mRNA, so it is no longer in our bodies. The mRNA vaccines, Pfizer and Moderna, do not contain any animal tissues, human fetal tissues, or any other foreign materials. And then another vaccine in our toolkit is the Johnson & Johnson vaccine. This vaccine is highly effective against severe COVID symptoms. The Johnson & Johnson vaccine uses a disabled adenovirus to deliver instructions. So this adenovirus is in no way related to coronavirus. It's a completely different virus. And although it can deliver instructions on how to defeat the coronavirus, it can't replicate in your body and will not give you any viral infection. All of these vaccines are effective against COVID-19. And lastly, there have been some concerns about the vaccine and the variant strains. So I like to explain that the vaccines are developed based off of the virus shape or structure. And so the vaccine trains our body to recognize the virus and essentially the variant strains as well. Boosters to increase immunity may be offered in the future, but the vaccines are effective against variant strains. But because the variant spreads more quickly and is highly contagious, we need to continue to take safety precautions, of course, maintaining social distance, wearing masks, and even wearing masks when wearing face shields, and minimizing and avoiding gatherings, although that can be hard as the weather is warming up. And these vaccines are just one of the tools in our toolkit. Therefore, to continue to decrease the spread of COVID while we work to get a larger proportion of the community vaccinated, we have to think that, we cannot control what other drivers do on the road, but we can buckle our seatbelts. And when you practice safety precautions, you buckle your seatbelt. And so now that I've given an overview on just the vaccines that are available and how they work, I would like to now turn it over to my colleague, advance to the next slide, please, 𝘊𝘅𝘆𝘆𝘐𝑒𝑟, who will detail her experience as a clinical trial participant for a COVID-19 vaccine. Michelle, please take it away.
Thank you, Naisha. Good evening, everyone. As Naisha said, my name is 𝘊𝘅𝘆𝘆𝘆𝘆𝘐𝑒𝑟, and I work for King County Public Health in the Community Health Services Department. I made a decision last September to be a part of the Moderna vaccine trial. After quite a few weeks of deliberation, I developed my own personal strategy for for entering this trial. And, you know, I, like many people, was pretty overwhelmed by how deadly this virus is and how impactful it can be, you know, sort of beyond a month or so. You know, there are plenty of people who, you know, had COVID over a year ago and are still struggling with some of the symptoms. And so I was really profoundly affected by that. And I asked myself, what could I do in the midst of what was a very tumultuous time in our country of mixed messages, to, you know, be able to actually talk about why it might be important to get this vaccine. So I signed up for the trial. I had a lot of questions, and I developed a plan. And that plan was, I gave myself permission to exit the study at any time if I felt like I wasn't being given full information as I felt was needed. I really needed to know that the providers that I was going to be working with were respectful and would be respectful in fielding any kind of questions that I had. And so, so I set up my first appointment. It was a phone appointment. I asked a lot of questions. I informed them that I actually had a plan for exiting the study if I felt like at any time I wasn't being treated in the way that I felt like I needed to be treated in what was a precarious situation of unknowns. At the time, I did not know that Dr. 𝘞𝘩𝘆𝘵𝘂𝘹 was one of the lead researchers and helped to develop the vaccine. And when I found out, I have to say that there was a sense of relief because I really felt like my own people wouldn't try to kill our own people. And so there was this sense of assurance, I think, that we had people who were really invested in finding something that was not only effective, but also safe. And safety is a real issue, right? The history of this country experimenting on Black and Brown people is well documented and well known. I am a survivor of medical abuse, both as a child and as an adult. The Body Keeps the Score. There's a book called The Body Keeps the Score. And my body has definitely kept the score of all of these, what I call assaults of disparate care. And, you know, every time I talk about this, I have to admit, I do get a little triggered because what you do to people matters and how you treat people matters. And so I got my first 2 shots and actually found out that in January that it was the placebo. So I was offered the regular vaccine in January and I accepted. I also chose to stay in the study, which was one of the, I could have exited the study, but I chose to stay in the study because I do believe it is going to continue to be important, particularly since we do not know how long the effectiveness of the vaccine is currently. You know, they have some ideas, but we actually don't definitively know. And so I have appointments, you know, once a quarter. They do a blood draw. They're looking at all kinds of things of which they do not tell us. And so now I'm able to actually talk about my experience with people. And I do so in a way, I'm not trying to convince anybody to get this vaccination. I actually don't think that that's our jobs. I think our jobs particularly as public health and medical professionals, is to ensure that we're giving accurate and detailed information with sources, so people can actually do their own research and decide whether or not for themselves these vaccines are right for them. I have family members who have chosen not to get the vaccine. They have all kinds of interesting ideas, like there are special microchips in it for tracking that these vaccinations are something similar to injecting something that's very deadly and infectious, like in the �々𝘂𝘵𝘶𝘴𝘵 syphilis experiment on Black folk. And so I'm careful about how I share this information, because I don't want to push them away. I actually want them to be equipped with the knowledge and information that they need to do their own research to make this decision. And with that, I think I will close. I wanted to say one more thing that I didn't do at the beginning. I recognize that we have all different kinds of interpretation happening. And for people who actually may not be able to see the panelists, I would like to just describe myself briefly. I'm African American. My hair is kind of curly in a ponytail. I have on a gray headband and gray glasses. And I actually have on a black and white shirt, but to some people who can see, I've been told it looks like forest green. So I'm not sure what's happening on the video, but I am actually not wearing a striped forest green shirt. I'm actually wearing a black and white shirt. And yeah, I see that forest green. I have no idea. It's kind of like, is the dress blue or is the dress red? I don't know why y'all are seeing forest green. I find that humorous. So with that, I will hand it back to Naisha.
Thank you, Michelle. And you know what? Half of you, I think it's the lighting, is showing green, and then the other half is showing a darker color.
And Naisha, before you go on, we are getting some messages in the chat that maybe the Somali interpretation isn't coming through. So Nora, if you don't mind checking on that, that'd be great. Thank you.
Okay, I will hold momentarily until you tell me to continue. No problem.
Nora, it's working now.
Excellent.
You were muted.
Are we good to go?
It sounds like it. Yes, thank you.
Perfect. Thank you so much for letting me know that. And thank
Yes, I can.
Oh, thank you, Michelle, for recounting your experience. I've listened in to you, detail your experience. And I have to say, every time I hear you go over it, it's like hearing it for the first time. And it's just, you're magical that way. So thank you. Thank you so much for participating and just giving us your wealth of knowledge. You are so appreciated. So now we are going to move on to the next segment of our agenda. For our panelists, please feel free to unmute yourself. We are going to I'm going to ask a couple of questions, and please feel free again to unmute yourself and answer in any order. So we're not going in any specific order for our panelists to answer these questions. And the first question that I would like to ask is, why did you decide to get a COVID vaccine? So why did you decide to get vaccinated?
Good evening, everyone. This is 𝘞𝘩𝘐𝘵. I go by he, him pronouns, and I'm the Executive Director at Asian Counseling and Referral Service. The primary reason that I chose to get the vaccine is for consideration for my family and also for my community. Knowing that if I am vaccinated, then I am there to support my family in case they need me, or if the community needs me. So that was really the reason behind why I got vaccinated.
Good evening, everyone. My name is Ahmed Ali. I am the director for Somali Health Board. I'm also a pharmacist. And the reason why I chose to get vaccinated after looking and determining the safety of the vaccine and figuring out that the vaccine is safe enough and understanding the impact that coronavirus has had on a lot of our communities, particularly communities of color. I thought it was important that if I am going to be talking about the vaccine itself, that I should be able to get it myself to protect myself, my loved ones, and also ensure the community understands that the vaccines are safe. So I actually documented my vaccine process in late January when I first received it. And one of the things I adamantly believe in is if I am going to be advocating for someone to take something, I am not the one taking it, then I don't think it comes out correctly, and it's hypocrisy to a certain extent. So I believed it. The vaccines work. They have always worked to a certain extent. And it's not the first time we're getting vaccinated or getting vaccines. And I wanted people to know and understand that, they protect us and the safety of it as a concern to our community. And that's the reason why I got vaccinated. And I feel pretty good about that.
Should I go next or? Cool.
Absolutely.
Okay. Excellent. So hello, everyone. My name is 𝘞𝘩𝘠𝘵𝘐. I'm an infectious disease physician at the University of Washington. I'm the medical director of the Northwest campus at UWMC. I also work clinically at 𝘊𝘘𝘵𝘠𝘵 and 𝘊𝘖𝘝𝘗𝑆. For me, and it's a pleasure to be here. I'm originally from Argentina, so I speak Spanish. That's my first native language. For me, it was really a question of choosing life. And the reason is that, unfortunately, this pandemic has devastated the world, has killed close to 600,000 Americans. We've had over 30 million cases in the US. We're seeing what's happening in India. And then initially we thought that this was a disease that was going to affect mainly the elderly. But in the area of vaccination, what we're seeing is actually right now at UW Medicine, we have approximately 50 patients, 50, and the average age is about 35 years old. I'm 45. So that really highlights the importance of taking this seriously. As an infectious disease doctor, I've always been a friend of vaccines. And in the United States, we're lucky to have a highly, highly excellent process of safety around vaccines and just processes in general that have to do with the approval of medications. So for me, it was really knowing and learning that these 3 vaccines are almost 100% effective at preventing death, hospitalization, and severe disease. So the first priority for me is when I got the shot, I started feeling the relief of knowing that I'm very, very extremely unlikely to end up in the intensive care unit or dead from this disease. And to me, that's the most compelling reason to get vaccinated. Even in the young folks who right now are lagging behind. And we're already seeing that the elderly are safer and the younger end up in the hospital. So that's basically what drove me to get vaccinated. Thank you.
And I will go next. It's a pleasure to be here as well. And similar to my co-panelists, my reasons are of community as well as personal. I believe that much of what we do in modern life takes risks into account. I take a risk when I drive to work or fly to visit my family or go to new countries or places. When I go to the gas station and touch the gas pump, I take risk in terms of getting other infections like the flu and the flu season. the risk of a previously unknown virus with a previously undocumented long-term consequence was much greater for me than the risk of the vaccine itself. And as some of my co-panelists said, the look at the development of the vaccine closely and understanding that while it was fast and furiously developed, the technological advances of the last several decades have made this possible, and that it was reasonable to expect the production of the vaccine to be in a very short period of time as it had taken. There were no shortcuts. In addition, I have received many vaccines without any problems in my life. Several different infections are prevented in the world because we take vaccines. So it was more of a pragmatic approach. And personally, I have a 90-year-old father who I'd like to see. And have responsibility towards those around me, not just within my family, but also those that I come in contact with. As a physician at the International Community Health Services, we have many elderly patients. We have many patients that are at risk of having severe complications from chronic medical conditions in addition to COVID. So it was my responsibility to make sure that I don't become the pathway to spreading COVID.
I think that if you'll be back later than like 9:30, you could let me know. Yeah.
I'm going to go ahead and move on to our next question for our panelists. And thank you so much for your insightful answers to the first question. My next question is, from your perspective, why should community members trust that the COVID vaccines are safe?
Should we follow the same order, or I'm happy to start?
Sure. Whoever is happy to start.
I think Michael started, right?
Michael.
Santiago, go ahead.
Okay. So why should we know it's safe? I think when I look at safety, I look at the system first. I also look at studies and the data. And we know that these two vaccines were, the mRNA vaccines were studied in over 70,000 people. That included people from all origins, color, race, ethnicity. And then after that, we've seen that we've actually given over 200 million doses of these vaccines. So for me, it's like today, it's a much easier conversation than it was back in December when we started that. And when I got the vaccine, back then, all we had was the clinical trials. And clinical trials are done in a very controlled setting. So it's not necessarily apples to apples when we think about how applicable these data are to the real world. And since then, we've had a ton of data. And we've had, again, over 200 million doses given. And we've had an array of side effects that have been pretty mild and transient. And, some people feel sick for 2 days, 3 days, but most people do well. And then we have very exceptionally rare reactions, adverse reactions or allergic reactions that happen over the course of 15 minutes after the injection. So for me, we have now a ton of data. We have a system that the minute we see a red flag, it gets alarmed and it pauses. We saw that with Johnson & Johnson. There were 6 cases out of 7 million doses that led to halting the operation, which is the right thing to do. You have a question, you want to answer it. So this is how reliable the system is. We're talking about 6 cases out of 7 million people. And then the FDA put a stop. So for all these reasons, I feel very confident in our system and in these vaccines.
Yes, along the same lines as Dr. 𝘞𝘡 has shared, there's enough evidence now in terms of the number of vaccines that have been administered to feel confident as a whole. But also, I trust the doctors who are here, our public health officials who are here, our pharmacists who are here, people who are representing communities of color, who have had their own experience of getting vaccinated. And I trust them, and that is why I would do it again.
Asquith, let's get to that.
Yeah. So I think similar to my co-panelists, the rarity of the complications from the vaccine and the protection from the vaccine on balance should be considered. Obviously, each individual person may have a question about their specific condition, their specific health concerns, and they can have a conversation about that with their primary care clinician. But on balance, the risk of the vaccine is much, 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 much less than the risk of the virus itself. I also want to interject what it means to larger communities. As you know, the individuals that have been much affected by this are communities of color, not just the impact of health and livelihood, lives, but also livelihoods. The economic impact of COVID is unprecedented. Many folks have lost their livelihoods. It has curtailed our activities. And so we need to get back to normal existence in which we go out to work, we communicate with our families and our social networks. And I think the sooner we vaccinate as many people as we could, the better and the faster we will get to that reality. So to avoid death, to avoid illness, to get back to our collective and community lives, we need to get vaccinated. And the faster we do that, the better it is.
Thank you. And Ahmed?
So one thing I can add on to what my co-panelists have mentioned is that I think the question that comes that's loaded with the word safety. It means a lot of things to different people. So it's important that we have to kind of clarify when we mention the safety of the vaccines, right? So for people to understand that for vaccines to be developed, they have to go through multiple phases. There are very rigorous, tightly controlled, different phases that, you know, my colleagues, Dr. Neiman has already mentioned. Thousands of people have to actually be on the trial itself before it gets moved on to the second phase and the third and gets onto the general population. So that process was meticulously done. There are also independent committees that are not providers, that are not researchers, that also evaluate the safety of the vaccines that we utilize here in the United States. And that is the process it has gone through. So not a single step was skipped in this development of the 3 vaccines that we're utilizing here in the United States. So that is an assurance about the safety of itself. But the other thing I also want to remind folks is that I think a lot of times when it comes to the vaccines, we think of it as something new. You know, I think of it as young children. I have young ones who we take to the pediatrician and they do get their vaccines, 3 or 4 vaccines that we're familiar with. It's sort of like the same thing that's protecting these children. At this point, we know the COVID has had significant impact all across the world and here in the United States as well, as has been mentioned. The amount of effort it has taken to actually get the vaccines to us and for us to be able to feel safer at this point has been significant. And over 200 million people have taken it. So I think understanding that notion that this is, it's not something we're starting off right away, but trials have been done. it's shown that it's effective and it's safe. And now we're talking about over 200 million Americans have already taken the vaccine itself. So I think it's understanding those things that makes it a lot easier for some people, that many people with very small side effects that have been mentioned, with the exception of Johnson & Johnson, has been discussed early on. That's also very minimal compared to the number of people who have received the vaccines.
Thanks again to our panelists for their insightful answers. And then my last question for our panelists is, what would you tell a family member or friend who is hesitant about getting a COVID vaccine? And I will start with, I'll mix it up a little bit this time. So I will call on Ms. 𝘞𝘩𝘕 to respond first.
I think the first place to start is exploring why that individual is hesitant. They may have experiences in the past. They may have questions that are not answered. They may have health issues that they're more worried about. It may be a few different reasons for them to express hesitancy. And we have to also be very clear that it is hesitancy. Sometimes it's just access issue rather than hesitancy. They just don't know how to navigate the system in order to get the vaccine itself. So we need to rule that out first and then get to their thoughts about the vaccine itself. What was their prior experience of being vaccinated? What is the information that they've gotten? Where is the information that they've gotten that has made them hesitant? What are the gaps? And it's at ICHS, what we try to do is invoke motivational interviewing to really get them to make that decision themselves, rather than giving them a bunch of information that they may consume or not. So consumable information for them to have all that they need, and helping them in that journey of getting to a decision. And they may not decide at the moment when we're having that conversation with them. It may be a decision that they will make a couple days later. So we need to give them some space as well to allow them to sort out their concerns about the vaccine. So I would say explore, provide the information that they're asking, give them space to make a decision.
Thank you. I'm going to call on another panelist, Ms. 𝘞𝘩𝘕.
I think I stated earlier, so my background is I was a healthcare provider. I was a midwife in this community for 12 years, and I had a birth center, and there are over 500 of these children, some of whom have graduated from college now, running around here. And so when I think about my work there, again, I still took the same approach that I do today, is to really give people information. I think one of the things that can happen in healthcare is, I think as healthcare providers, we can step over into this sort of orientation of, you feel really strongly about something, the data is really, really good and really strong, and your heart really wants this person to be safe and be well and be healthy. And if we're not aware of that, that can influence how we're engaging with people. But I know for myself, I don't want somebody to tell me to do anything, right? As a healthcare consumer, and I was real clear when I got my new doctor, I said, you don't get to tell me what to do. I'm the patient. I can actually understand what you're saying, and I think our approach should be to engage in a conversation that anyone can understand it. It doesn't have to be technical language or these high level terms that sometimes providers can use. And so when I think about one of the people that I actually really need to have a conversation with is one of my aunts, who is a caretaker for my 95-year-old grandmother who has been vaccinated. But my aunt has not been vaccinated. And she really believes a lot of the misinformation that is floating around in our communities around, you know, this vaccine is, you know, going to kill Black people or whatever. And so I'm thinking about how I'm going to have that conversation with her, because I know for a fact that she has some health issues that put her at risk for possibly ending up in the hospital. And none of us want to see that, right? And so what can I say in such a way that will actually make her think about reconsidering and not feel like she's being pressured or scared into or manipulated into getting this vaccine. And I can appreciate and understand that some people really want to wait to see, you know, they're waiting for this magical time when they're convinced, and that's okay too. And we still have to hold firm to, we've got to wear our masks, we've got to continue to social distance, we've got to do all those things that we were doing before there were vaccines, if people are choosing not to be vaccinated. And then there is going to be a time where I think the majority of people will be vaccinated. And so we will have this thing called herd immunity. That's how we get to that. And so for those who can't, and there are a very small percentage of the population who may not be able to get any of these vaccines. I don't know what the number is. It's inevitable because it happens with vaccines for whatever reason. There may be a couple people who are allergic, let's say, to some of the ingredients, but they're going to be a really small number. And they may still choose not to. But for the rest of us who do choose, we are then contributing, hopefully, a little bit of protection for them, right? That they're not going to get it from us. So I think it's really, you've got to approach this. It's our job is not to convince people to make the decision to get the vaccine, but it's to give them the information that will empower them to make this decision on their own. We don't empower anybody. How we work with them, the information we give them is actually what delivers that power. And I think that's the approach we have to take, because if we shut off the conversation, then we've lost, right? But if we can keep engaged with individuals who are hesitant or afraid or still wondering, then there's that door there's that open, still the door is open, even if it's a little crack, that maybe at some point, something we might say may lead them to make the decision, if they can, to get the vaccine themselves.
Thank you, Michelle. And that level of protection that you describe is what we call herd immunity. So the more people that we vaccinate, we offer that protection towards our communities. Next, I will call on Ahmed.
Thank you. I think in response to that question, sort of reiterating what 𝘴𝘆𝑗 had mentioned, I think it's looking and determining where that individual is at. And we've had multiple conversations over the last several months, particularly within the Somali community, answering a lot of questions about the many misinformation about the vaccines that were circulating on social media and other platforms. But we also have other individuals who you can share as much information as you want, but at the end of the day, the messenger has to be the right person. And I think what I'm referring to this is there are folks who needed a religious person to actually answer certain questions for them, not even the healthcare provider themselves. So we actually had imams come into some of our Zoom meetings and talk about the Islamic and medicine, understanding of, after, of course, having the conversation with them irreligious leaders, for them to answer some of those questions. And particularly more so now with the Ramadan going on and folks fasting, it's a concern that we had that some people might actually be hesitant to get vaccinated because they're fasting throughout the day. And, you know, in particular for that example, I think it was very helpful to have someone that they can relate to and have ultimate respect for, not just the clinicians, but also the imam of the mosque, to have that conversation with them. So I think on a personal level, I think trying to figure out what that individual is worried about and giving them the information has been mentioned by my colleagues here. But at the same time, trying to figure out what other information can you share with, and who are the messenger can you send aside from yourself, and not just looking as a healthcare provider.
Thank you, Ahmed. Next, I'm going to call on Santiago.
Well, excellent points by everyone. I just wanted to add a couple of points that have been helpful for me. I think in healthcare, unfortunately, we tend to embrace paternalism, this issue like, I'm just going to tell you how this works. And a lot of the healthcare providers, some of us feel like it's completely crazy that people will not want to get these highly efficacious vaccines. And we kind of lose patience in that conversation. This is when you start to get very bossy and trying to really convince people. So I think we've learned, a lot of us have learned from that. And we know that in medicine, it really pays off to listen. And that's why I really liked how Dr. 𝘫𝘠𝘕 really got to the listening part. What is really the issue? What is the question? What is the concern? And kind of get to that. I also think that we live in a world of misinformation. So a lot of the people have very easy access to a lot of just crazy information that's not true and they're not facts. So we kind of need to battle that, right? While not trying to get all bossy and impatient. And we need to get it all in within 15 minutes of that appointment while we're trying to manage blood pressure and other things. So it's kind of a difficult task, but one thing that I like to do is to really provide information through explaining why. Why is it that it's okay for me to have lunch outside with a friend and not so much inside a restaurant? Why is that? Well, maybe it's because we know now that this virus gets spread through the air. And in a closed environment, right, if I remove my mask to eat, this is when I can get COVID, right? So even though I'm vaccinated, there's a very minute risk. Minute, it's clearly minute, right? It's less than 1 in 1,000 that you will get COVID. And if you do get COVID, you will not die from it if you're vaccinated. So all of these things I like to explain in the setting of, and the other thing I like to explain currently that it's really, really exciting is I think that in medicine, we tend to think about in binary terms. It's 0 or 1, it's all or nothing, right? But with COVID, it's more of a dial, right? With COVID, it's like, I'm starting to loosen restrictions. I'm starting to tell you that maybe outside, you will be fine not wearing a mask if you're walking by yourself or with a friend who's vaccinated, right? But maybe not at a concert where you're in the middle of multiple people, right? So I'm starting to share that there's light at the end of the tunnel, and the vaccination really gives you a key. And not only a key when we're all in herd immunity, it gives you a key today, because right now I am safer for being vaccinated, and I can go and have a coffee with a friend of mine at my house and not be wearing masks if we're both vaccinated, right? So all of these things are really interesting to see. And the list of things that we can do while vaccinated, it's really long. It's getting longer and longer. And I like to share those exciting, because a lot of people are saying, why would I get vaccinated if I still wear a mask? Well, not always. Right now, there are situations where you don't really need a mask. So again, sharing those updates based on science in a language that people can understand them, and not really forcing information or decisions. I do agree. I think Dr. Getterman made that. No, I think Michelle made this point. Initially, it was no, maybe Dr. Getterman. It was about hesitancy, but it was also about access. Right now, I'm really excited because there's a ton of access. I still see patients who do not have a phone. You know, I work at Harborview. A lot of my patients don't have a phone, don't speak English. So that's a patient that I really want to do extra for. That's the patient that I really want to schedule when they're seeing me. That way they leave the appointment with the appointment for the vaccine in clear language. Anyway, that's what I wanted to add. Thanks.
Thank you so much, Santiago. And I think you really, really hit it home about being fully vaccinated and the doors it kind of opens up. As someone who's fully vaccinated, I definitely have experienced times where I just sigh that relief, like, whew, I'm so glad I'm vaccinated. Our next panelist to answer this question is Michael.
Yeah, no, thank you. I think what Ahmed had said was really resonates with me, the importance of trusted messengers in our community, whether they are faith-based leaders or organizations, and how they play an important role in making sure that community individuals who have questions about the vaccine can go and get reliable, accurate information. I think this is incredibly important in our community, Asian and Pacific Islander communities, where we have many languages, and to have the opportunity to connect with an organization that has a Vietnamese speaker or a Laotian speaker who can explain some of the materials that they've been provided related to vaccine and questions and answers related to that. So I think that's going to be really important. Continue and encourage individuals to seek out information, accurate information, seek assistance from trusted messengers like community-based organizations and community leaders. I also think it's really important, again, around the concern with misinformation. It is unfortunately very rampant in languages other than English, and that is extremely dangerous because it just takes one individual who is convinced it's accurate information, and then it spreads like wildfire throughout the community. So just to continue to encourage people to understand the different types of sources that are available, recognizing sources that are from the CDC or from public health. Those are reliable sources of information. Any of the other pieces of information that you receive, just to continue to question, be curious as you are, as you take that important path towards making a decision around getting the vaccine. Make sure that you have accurate information and make sure to question what you hear.
Thank you so much again to our panelists with so many insightful answers, and it's really, really great to hear you all's perspectives. Now we are going to move on into the agenda for the question and answer portion. For anyone who has a question, please place it in the chat. We have about 30 minutes for Q&A, so we'll try our best to get to everyone's question. The first question that I have is, and this is for any of the panelists that would like to answer. For the clinicians, have we learned anything more about whether vaccinated people can transmit COVID even if they don't experience symptoms?
Should I answer, or does anybody want to answer it? Or
I'm going to say, Santiago, that you are the expert.
okay.
Answer.
Yeah, so we've learned a lot. We've learned that infections after being fully vaccinated are extremely rare. From Washington State, we had a study where we had 1 million people who were fully vaccinated, and only 102 people were infected after that. And a third of those were actually asymptomatic. They did not have any symptoms. Remember that COVID is an infection where if you're asymptomatic, it doesn't mean that you do not shed. You could still transmit. But what's really key about this is the effect of that vaccine, of these vaccines, is so great that only a minute proportion of that was positive. In a bigger sample by CDC, 89 million people fully vaccinated, the risk of having COVID after being fully vaccinated is 0.005%. Tiny, right? Super small risk. So again, we know that that risk is, in that series also, a third, actually 29%, were asymptomatic. So they were not having symptoms. So can folks who don't have symptoms transmit? Absolutely. After being fully vaccinated, are you likely to have an infection? Very unlikely. It does occur, but it's very unlikely.
Thank you so much, Santiago. Do any of our other panelists want to add anything? Okay, I will move on to our next question. If someone chooses to only get one dose of the Pfizer or Moderna vaccines, how effective is the vaccine and how long will protection last?
I want to give others the opportunity. I obviously know these answers, so I just don't want to do everything. So
anyone.
Speak up.
I think Dr. 𝘞𝘡𝘴, you should answer all the clinical questions.
Oh.
You're the infectious diseases specialist.
So initially, we thought that the one dose of Pfizer and the one dose of Moderna were going to be extremely effective. And the truth is that they are pretty effective. But what we see is that the response, the very effective response or robust response, wanes. This is why it's so important to get the second dose. We unfortunately know that in the US, approximately 8% of folks are saying, I don't want the second dose because I've heard that the first dose, well, it's true, the first dose is effective, but then it wanes. So now we're seeing that really there's a really good rationale at 6 months to have had the 2 doses, right? So the studies of folks who have received the 2 doses and then rechecked at 6 months, we saw that they have really good protection, but the ones who only got 1 didn't. So I would say it's probably half as effective to get 1 dose, and we don't know the durability. We do know that from the 2-dose regimen, you at least have 6 months of protection, and we think that it's probably likely much longer than that. We're hoping that it's at least 12 months, so a year at least.
I would add also that individual variability exists in vaccine response, so you shouldn't take the risk.
Exactly. And then, thank you so much. The other point that I wanted to make, the one subset of the population that we have some concerns about around efficacy or effectiveness is the population who is extremely immunocompromised. So we have some emerging data that in patients who have had a transplant or patients who have had a bone marrow transplant who are getting significant chemotherapy, those folks do not have the robust response that folks who do not get those treatments get. So that's something really important to remember, that those patients, and this happens with every vaccine. Vaccines typically don't take as much in folks who have an abnormal immune system based on medications or treatments that they're undergoing.
Thank you. I want to do a quick reminder for the panelists to please speak slowly for our interpreters, and thanks for the answers. Santiago, I have another clinical question, just heads up. So if a person has heart disease, what is the risk, if any, of developing myocarditis after getting the Pfizer vaccine?
Yeah, so this is the person asking the question has been reading a lot recently because Israel has reported a small series of cases of myocarditis, and the scientific community is looking into that. Myocarditis is basically an inflammation of one of the layers of the heart, the muscle of the heart. And it's typically a reversible condition. So we're trying to identify whether those cases were actually related to the Pfizer vaccine. At this point, it's inconclusive. So people are looking into that. I would say millions of people with heart disease have received the vaccine and have been fine. So currently, I don't have enough information to say that this is a real issue. The problem with these reactions that sometimes it's hard to link cause and effect. And that's why we need to study them more deeply and thoroughly to then come to a conclusion. But I would say UWMC, we have many patients with heart transplants, and honestly, that population should be getting the vaccine without any type of delay because there are a high risk for complications, but also remember that their efficacy may be a little bit lower. So we need to be careful around that.
Thank you. This next question is both clinical and philosophical. So do you foresee the vaccine as being an annual thing? So folks are wanting to know, just from the panelists, do you foresee us having to get the vaccine every year?
So I think one thing to remember is that coronavirus is new to all of us. This pandemic is new to all of us, and a little over probably less than 2 years ago, none of us were even imagining the current situation which we've gone through last year and still going through to some extent. The virus that causes coronavirus, COVID-19, some of you probably have heard in the news, the different variants that are coming from different around the world, whether you hear if it's the Brazil variant or South African and others. One thing that I want folks to know is that there's a lot of unknowns at this point when it comes to COVID-19. But with the way the vaccines have been, utilized at this point, it's hard to tell because we're still studying a lot of the long-term, immunity that the vaccine gives once you get the vaccine in your body. There's a lot of studies still going on. So I think there is a possibility to a certain extent, and the jury is still out there, that it could become just like the flu vaccine that you're getting every year. That's a possibility. But at the same time, the more all of us, or probably as you heard the word herd immunity previously, are vaccinated, the sooner we can come out of this pandemic. But I think, I let Dr. Santiago chime in on this one. But my understanding from what we're gathering is that it could be on an ongoing annual basis that you're getting vaccinated as well.
Yeah, thank you. I think it's certainly possible that we will need a booster. Initially, we were very concerned about the variants and the mRNA vaccines' ability to really neutralize these variants. And the truth is that the vaccines are proving to be excellent at handling all these current variants. However, I would say that if we want to think about how we know, I think that it's through two main mechanisms. One is the data that CDC is collecting, like I just quoted, that out of 89 million people, we've had 5,000 infections after being fully vaccinated. So the minute we're seeing that the rate of infection in fully vaccinated is going up, then we should be concerned. And second, we're lucky to be at the university in this area because the University of Washington lab was one of the first labs to actually have a test for COVID-19 in the US. outside of CDC, and we're doing surveillance. So we're actually looking at the different variants, and we keep a close tabs at the variants and then match that to the vaccine. So I think that through those two mechanisms, we will know what, whether we need to really create or come up with a booster. Lastly, I would like to say that the pharmaceutical companies are already ready to have a booster that could update the genetic components to tackle different mutations. And that's the beauty of this mRNA technology that's been developed, as Naisha pointed out, over the last 2 decades, is that it's very, we can be very agile in modifying and making sure that we prep a vaccine that can then give us that additional protection against those variants. But honestly, I couldn't have dreamt of better vaccines at this point. When you think about everything that's going on in the world, having vaccines that are this effective. So I would say it would take a lot, and but I think that if we need to do that, I think we could do it. I think we can do it as a community, and from science, I think we're really primed to make that happen.
Thank you. Our next question is, if I get vaccinated and have to travel, do I still need to have a COVID test before or after travel?
Right, so for this, the CDC has a really nice chart now, and it depends where you travel. So domestically, if you're fully vaccinated, well, it depends. CDC will tell you that you don't need to have that. But if you go to Hawaii, Hawaii may require that from you. So it just depends. But I would say CDC doesn't feel like when you travel domestically, you need to be tested before or really after. This is how efficacious these vaccines are, because we're not seeing people getting infected. I mean, massively, right? Just very few cases. Internationally is a different story. And the issue with travel internationally is that we don't demand it or require that in the US, but the country we're going to might. But then remember that right now, unfortunately, there's a huge inequities in terms of vaccine allocation. So we are fortunate to have a lot of vaccine supply. Not the case in India, not the case in Argentina, where I'm from, not the case in Europe. So you're going to encounter a lot of people who are unvaccinated in those travels. So it's different from traveling domestically currently, and it's quite unfortunate.
My next question is a clinical question. Is it true that the Moderna virus can cause arrhythmia?
COVID-19 is well known to cause arrhythmias. With the mRNA vaccines, we haven't really seen, we haven't really tied arrhythmias to these vaccines. So I guess it could happen, but the question is there a true link? I'm not aware of any warnings around folks who have arrhythmias who should not be getting the vaccine. We've probably seen that, but it's hard to link the arrhythmia to the vaccine. But we definitely have had significant arrhythmias with the actual COVID infection.
For our next question in the chat, from the vaccine breakthrough cases in Washington, the question is, from the 5 suspected deaths, do we know if these folks were fully vaccinated? And if so, was it within the 2 weeks after the 2 weeks from getting their vaccine?
I would have to check on those 5 cases. And again, with death, it's more difficult to tie that to the vaccine. Like we would have to do the autopsy and all of that. I don't have the data. All I have is the data from the University of Washington where I work, and we haven't had any such case. So I would basically defer that to public health or Washington State. But again, when we're talking about 5 people who died out of 1 million, again, it's a question of of the true incidence of these things and whether they're related. And I'm sure these cases are being investigated. And knowing Dr. Duchen and everyone else in Washington State, I'm sure that's being looked at. I just don't have the information.
Okay, we have another question in the chat. And before I continue, I just want to remind our audience to feel free to put any questions that they have in the chat. We still have a couple of minutes left for Q&A. And now I'm going to go ahead and proceed to read this question. And it is for you, Santiago, specifically. It states, the study you mentioned that around 100 patients out of the 1 million patients who are fully vaccinated still got infected. When did the majority of infection happen? For instance, how many days after the second dose? 2 weeks versus afterwards? And is there any subgroup stratification data published?
Well, what I can tell you, what I remember about reading this, it wasn't really from a study, it was directly from the Washington State Department of Health. And they looked at 1 million people who were fully vaccinated. Let's remember that being fully vaccinated means that you're 2 weeks out, 2 weeks after your last dose. If you took Johnson & Johnson, it's just 1 dose, but if you took Pfizer or Moderna, it's 2 doses. So it's 2 weeks after the last dose of that regimen is when you're fully vaccinated. I would have to go back to that website. I think someone added the link, but there is a website where you have all the information, and maybe at the end of the meeting I can find it. But it's a Washington State. If you Google Washington State and put 1 million, it's called breakthrough infections, what we're looking at. And then CDC, out of the 89 million people, also in the CDC, you have a breakdown of ages. It's really remarkable whether they were having symptoms or not. So there's just a lot of information on those websites. Not in the form of a paper that I'm aware of, but I'm sure it's coming.
Thank you so much. And thank you everyone for all of your questions. Thank you to our wonderful panelists for giving your insights about why vaccination is important, and also for answering some of our clinical and more technical questions about the vaccine. And so now, if we don't have any further questions, I'm going to give some information about how folks can get vaccinated. So for getting vaccinated, we encourage the community to call your doctor or healthcare provider, ask if they have appointments. You can also use Washington State's vaccine locator at vaccinelocator.doh.wa.gov. Select your language in the top right corner of the drop-down menu. And you can also get help making an appointment by phone. You can call the King County COVID-19 call center any day between 8 a.m. and 7 p.m. at 206-477-3977. Interpreters are available. Just state the language you need when you are connected. Advance to the next slide, please. For transportation to your appointment, there is phone assistance. So call the Coordinated Vaccine Transportation Helpline at 425-943-6706, Monday through Friday, 8:30 a.m. to 4 p.m. Press 5 for interpretation. And then you can learn more about transportation options at findaride.org/COVID. Advance to next slide, please. And then you can find more information about the COVID vaccine at our public health website. So kingcounty.gov/COVID/vaccine. And you can request a presentation by filling out a request form at kingcounty.gov/COVID/speakers-bureau. And then there is also a bi-weekly community partner call. Write to phpartnerships@kingcounty.gov. So a lot of wealth of information from transportation to presentations and just obtaining more information about COVID vaccines, including handouts you can find on the public health website, information about getting vaccinated, and some great talking points to spread information throughout your communities. So again, I would like to thank our wonderful panelists for all of their contributions and their wonderful insights. I would like to thank our ASL interpreters. Also, just thank you to everyone for attending, and thank you for our first community conversation and hopefully one of many more. Thank you all. Thanks so much to the community and have a great night.